Congratulations! You are well into your final month of your pregnancy, month 9. If you haven't already given birth, don't worry. Your time will come soon enough. And if you have passed your due date and are stressing, hang in there. In fact, 30% of pregnancies go past the 40 weeks marks. What's important to remind yourself is your baby has reached full term and is fully grown. Now that is an accomplishment. When your baby does arrive, their head may appear slightly pointed after delivery due to the passage through the birth canal. Again, this is completely normal and will reshape itself in the hours and days to come. Your baby is now the size of a small pumpkin, weighing roughly 8 pounds and reaching approximately 20 inches, which you could have probably guessed given the strain on your back. During this time, it's important to know that your baby will be born with a red or purple skin tint as her blood circulation is still maturing at week 40. Because your baby's blood circulation is still maturing after birth, their hands and feet may remain this purple-bluish color for several hours to days. This will change with time, and over the next 6 months, your baby's skin will develop into its permanent color. At this time, your cervix will start preparing for birth or may have already. Due to the loss of your cervical mucus plug, you may experience some bloody discharge. Your cervix is actually opening and thinning, called effacement, to prepare itself for delivery day, and the cervix will continue to dilate until labor day. Unfortunately, you might also experience some labor pains, so focusing on your breathing techniques to get through to those painful moments is crucial. You may also be wondering when your water will break, and if you are a first-time mother, what the sensation of water breaking feels like. Unlike the movies where a woman's water breaks during a dramatic scene with gushing water, your water breaking will most likely appear as a small gush or slow leakage of water that may or may not be associated with contractions. A key way to tell if your amniotic sac has ruptured is checking if the fluid is colorless and odorless. If the fluid looks yellowish and smells of ammonia, then it is most likely just urine leaking. If your water breaks with brown or green fluid, make sure to call your practitioner, as this could mean that your baby has had a bowel movement, releasing that sticky meconium prematurely into their amniotic fluid, and your doctor will want to know in case interventions need to be made. At the 40-week mark, your doctor may check your cervix to see if it's ripening. Your cervical position, degree of softness, thickness, and dilations are all key indicators when determining how your labor will be induced if needed. You also may deny this exam if you choose to. You may be induced if you don't go into the labor on your own by 41 to 42 weeks. But talk to your doctor about what your desires are so they can best meet your birthing desires and needed. You are so close to the finish line. So the big question is, have you decided on any baby names? If not, now is the time to get brainstorming. You have been through so much and it can be very stressful if your baby still hasn't arrived. Do things that will keep you busy and calm, such as kicking back and watching TV, reading a good book, taking naps during the day, and speaking to close friends and family members. You're almost there.